Subjective symptoms. Organic stricture may exist for years, producing no symptoms and unsuspected. On the other hand, the usual symptoms of stricture, gleat, the irregular stream of urine, and the final dribble, are of daily occurrence among men who have not and never had stricture. The onset. Symptoms occur within 1 year in over half the cases, though 1/4 of them show no symptoms until after 5 years have elapsed, and the onset may be deferred for 15 years or even longer. But only 1/3 of my private cases submitted to treatment within a year of the beginning of their symptoms, another third within 5 years, and 1/7 delayed treatment until their symptoms had existed for 10 or more years. Gleat. The initial symptom is usually the presence of shreds and more or less free pus in the urine. If the stricture follows immediately after a gonorrhea, the urethral discharge is perpetuated. But more often there is a lull while the shreds and perhaps the general cloudiness of urine persist, but in the absence of a notable gleat do not attract the patient's attention. The shreds and pus are evidence of the local inflammation on the stricture, which is adding fuel to the flame and encouraging extension and contraction of the fibrous tissue beneath. As the stricture contracts, the urethritis grows worse and, sooner or later, produces a moderate chronic discharge, perhaps only visible in the morning when the urethra has not been scoured by the urinary stream for 8 hours, perhaps persisting throughout the day. This is gleat. It is usually the first symptom noted by the patient. The gleat of stricture gets better or worse according to the general condition of the patient, the degree of acidity of the urine, and the amount of sexual indulgence or of venereal excitement. Exacerbations of gleat from slight causes or repeated attacks of gonorrhea, as the patient usually considers them, often constitute the most marked feature of the case. In fact, it is the rule in mild cases for the patient to be wholly unconscious that his urethra is at all narrowed. Gleat was the initial symptom of 238 of my cases. Changes in the stream. As the stricture tightens, fresh symptoms are added. The gleat continues. The stream of urine is small and irregular. Footnote: it is to be noted that while an impediment anywhere in a water pipe, such as the urethra, modifies the force of the stream, the shape of the stream depends chiefly upon the shape of the nozzle, the meatus. Thus, the shape of the stream, upon which so much stress is commonly laid, has no bearing on the diagnosis of stricture. It is modified by the meatus itself more often than by any other cause. The last few drops of urine are retained in the canal, both mechanically by the obstruction of the stricture and because the wave of blood, impelled by the contraction of the accelerator urinae upon the bulb in the final effort at clearing the canal, cannot pass along the corpus spongiosum on account of the obliteration of its meshes at the point of stricture, and thus fails in its function of expelling the last few drops of urine from the canal. By this same obliteration of spongy tissue, erection is sometimes rendered imperfect and painful. Obstructed urination was the first symptom in 77 of my cases. Frequent micturition. Next to gleaty discharge, frequency of micturition is the commonest symptom of stricture. It is due to one or all of the following factors, viz. Congestion from straining to overcome the urethral resistance, cystitis, polyuria due to renal congestion. With the frequency, there is more or less pain. This was the initial symptom in 61 of my cases. Retention. The congestion of the stricture may be kindled by a heavy dinner, a little excess in drink, or a chilling of the legs. The mucous membrane swells, the stricture closes, and acute retention of urine results. If this retention is unrelieved, the bladder becomes overstretched, and the case progresses like an acute prostatic retention, page 294. Retention may be the only prominent symptom. The gleat may not have been noticed, The gradual decrease in the size of the stream may have been ignored when, after exposure, excess, or a carouse of beer, retention suddenly comes on. Such was the procedure in 31 of my cases. Hematuria. Exceptionally, hematuria may be the most prominent symptom of stricture, indeed the only one noticed by the patient. This happened 3 times in my series. The bleeding comes from an ulcerated spot and may be quite profuse. The blood usually continues to drip after the close of micturition, urethroragia. Pain. Pain on urination is due to prostatitis, cystitis, or retention. The pain is felt at the neck of the bladder, in the perineum, at the point of stricture, or near the glans penis. Sexual symptoms. Excepting the impotence which results from grave stricture, all the other sexual symptoms that have been traditionally accredited thereto are actually referable to prostatitis, vesiculitis, or verumontinitis.